This is from the book, The Network Awakens, Chapter 3, Healthcare System Infiltration. The pre-dawn quiet of Denver's healthcare district carried a quality of anticipation that Elena Rodriguez had learned to recognize during her years of integrating consciousness approaches with medical practice. This wasn't the anxious tension that characterized most healthcare environments, but expectant calm that emerged when awareness practices enhanced rather than replaced clinical effectiveness. Patient care relationships served healing rather than just treatment delivery, creating therapeutic partnership that honored both medical expertise and human development through conscious healthcare applications. At 6 a.m., standing above the rooftop garden above Presbyterian St. Joseph Hospital, Elena prepared to coordinate the most ambitious healthcare consciousness integration yet attempted. She would facilitate simultaneous awareness-enhanced patient care across multiple medical facilities, collaborating with consciousness communities in Portland, Austin, Chicago, and Boston. These communities were developing their own approaches to healthcare transformation through consciousness applications that serve both clinical effectiveness and healing relationships that addressed authentic therapeutic needs rather than just institutional efficiency requirements. The rooftop garden itself reflected the evolution of healthcare consciousness work from individual practitioner development to institutional integration. The integration served both patient outcomes and provider wellness while maintaining professional standards and clinical effectiveness. These standards satisfied medical institutions and regulatory authorities that evaluated healthcare quality through conventional metrics. Where once Elena had practiced meditation in isolation between clinical shifts, the space now hosted group awareness sessions for medical staff who had discovered that consciousness techniques could enhance diagnostic accuracy, improve patient relationships, and reduce professional burnout, affecting healthcare delivery throughout conventional medical systems. Denver's altitude created unique challenges for healthcare consciousness integration that couldn't be solved by simply adapting approaches developed at sea level. This required awareness techniques specifically designed for high-altitude physiological conditions that affected both patient health and provider capacity in ways that standard medical protocols didn't adequately address. The physiological effects of high-altitude living affected both patient conditions and provider capacity in ways requiring consciousness techniques specifically adapted for reduced oxygen availability and atmospheric pressure that influence cardiovascular function, respiratory effectiveness, and neurological conditions. But the altitude also provided unexpected advantages for consciousness development work that Elena hadn't anticipated when she began integrating awareness practices with clinical care. The thin air seemed to enhance sensitivity to subtle energy phenomena that consciousness approaches utilized for healing applications. This created conditions that supported both diagnostic accuracy and therapeutic relationships that made medical care genuinely healing rather than just technically competent treatment delivery that satisfied insurance requirements without necessarily enhancing patient empowerment or provider satisfaction. Healthcare workers reported increased intuitive accuracy in patient assessment, enhanced empathy and emotional regulation during difficult medical procedures, and improved capacity for maintaining present moment awareness during extended clinical shifts. These shifts typically led to fatigue and diminished effectiveness that characterized conventional medical practices operating under institutional pressures, which were prioritizing efficiency over therapeutic relationship, that quality. And it served both clinical outcomes and human development through conscious healthcare applications. Elena's morning routine had evolved to include what she privately called institutional sensing, perceiving how consciousness approaches were influencing healthcare delivery throughout Denver's medical system. She maintained connection with similar work in other cities that faced different healthcare challenges and institutional contexts, but shared commitment to awareness-enhanced healing. This served both individual patient needs and healthcare system transformation that could benefit healthcare delivery beyond consciousness communities through practical application that demonstrated measurable improvements in both clinical outcomes and therapeutic relationships. The challenge was integrating consciousness techniques with evidence-based medical practice in ways that satisfied institutional requirements for clinical effectiveness while preserving the awareness-based relationship qualities that made consciousness approaches genuinely therapeutic. These approaches needed to serve authentic healing rather than just alternative medical techniques that might appeal to spiritually inclined patients, but couldn't demonstrate measurable improvements in health outcomes. Such improvements needed to satisfy medical administrators and insurance requirements that evaluated healthcare systems' effectiveness through conventional clinical metrics. Over the previous months, Elena had worked with medical colleagues to develop documentation systems that could track both conventional clinical metrics and consciousness effects that enhanced healing relationships, treatment adherence, and patient empowerment. These contributed to health outcomes in ways that purely technical medical approaches couldn't measure, but which patients and providers could verify through direct experience and clinical observation. This verification was based on authentic therapeutic improvement rather than just subjective spiritual satisfaction that might provide personal comfort, but didn't necessarily translate to measurable healthcare improvements. The healthcare consciousness integration had revealed that awareness practices could enhance medical effectiveness without requiring healthcare providers to abandon scientific methodology or evidence-based practice. These form the foundation of professional medical training and institutional credibility that protected both patients and providers from medical malpractice while maintaining clinical excellence. Instead, consciousness techniques could improve the quality of attention that medical professionals brought to patient assessment, enhance communication skills that serve both diagnosis and treatment planning, and support emotional regulation that enabled healthcare providers to maintain effectiveness during challenging clinical situations. But the integration also faced resistance from healthcare administrators who were concerned about liability issues, insurance reimbursement, complications, and regulatory compliance challenges that consciousness approaches might create. These concerns centered on whether awareness-based healing provided measurable benefits that justified potential risk to institutional credibility and professional licensing. Such risk could affect the hospital's capacity to provide conventional medical services that satisfied both patient needs and regulatory oversight requirements for clinical safety and professional medical practice. Medical institutions operate under legal and financial constraints that require documentation, standardization, that awareness-based healing relationships couldn't easily provide through conventional medical record systems. These systems were designed for technical medical interventions rather than therapeutic relationships that enhanced healing through consciousness applications serving both clinical effectiveness and patient empowerment. Elena learned to present healthcare consciousness applications using language and metrics that institutional systems could evaluate, while preserving the essential relationship-based qualities that made consciousness approaches genuinely therapeutic. Patient satisfaction scores improved. Clinical error rates decreased. Provider burnout showed indicators showing measurable reduction that satisfied administrative evaluation requirements for healthcare effectiveness and staff wellness programs. But the most significant changes occurred in healing relationships that couldn't be quantified, but which transformed medical care from service delivery to collaborative healing partnerships. These partnerships serve both clinical outcomes and patient empowerment through therapeutic relationships that honored both medical expertise and patient autonomy while fostering authentic healing rather than just symptom management. The catalyst that tested Denver's healthcare consciousness integration emerged through systemic challenges from insurance companies and medical licensing boards. These questioned whether consciousness approaches represented legitimate medical practice or constituted unregulated therapeutic interventions that might compromise patient safety. They suggested that awareness-based healing provided inadequate treatment that failed to meet established standards for clinical care and professional medical practice, that protected patients from medical malpractice while ensuring therapeutic effectiveness through evidence-based medicine. The challenge began when Dr. Margaret Thornfield from the Colorado State Medical Board arrived at Presbyterian St. Joseph Hospital with a team of investigators. They had received complaints about unconventional therapeutic practices that allegedly violated professional medical standards and potentially compromised patient care through unscientific approaches. These approaches allegedly prioritized spiritual practices over evidence-based medical treatment that satisfied professional standards for clinical effectiveness and patient safety. Elena's first vulnerability moment came when she realized that healthcare consciousness integration was attracting institutional scrutiny that could either validate awareness-enhanced medical practice for mainstream recognition or expose it to regulatory challenges. Such challenges might prevent healthcare workers from applying consciousness techniques in clinical settings even when they demonstrated measurable improvements in patient outcomes and in provider effectiveness. These improvements satisfied clinical evaluation but didn't fit conventional medical categories that regulatory oversight used to evaluate professional medical practice and patient safety. But Dr. Thornfield's investigation revealed unexpected complications. The consciousness-enhanced patient care was generating clinical outcomes that exceeded conventional medical standards while maintaining full compliance with established medical protocols and safety requirements. Patient satisfaction scores were significantly higher than hospital averages. Clinical error rates were lower than departmental norms. Provider burnout and turnover rates had decreased substantially in units where consciousness techniques were applied to enhance therapeutic relationships and clinical effectiveness. The investigation team was forced to acknowledge that healthcare consciousness applications were demonstrating superior rather than compromised medical effectiveness while maintaining professional standards and patient safety. These satisfied regulatory requirements for clinical excellence and therapeutic effectiveness. The consciousness techniques weren't replacing medical treatment, but enhancing the quality of medical relationships and clinical attention that served both therapeutic outcomes and professional satisfaction. This benefited healthcare providers while improving patient outcomes through enhanced therapeutic partnerships that honored both medical expertise and patient empowerment. However, the institutional challenges escalated when insurance companies began questioning reimbursement for medical care that included consciousness approaches. They argued that awareness practices constituted alternative medicine that shouldn't be covered under conventional health insurance policies. This occurred even when consciousness-enhanced care demonstrated improved clinical outcomes and reduced healthcare costs through enhanced treatment effectiveness and reduced medical errors that benefited both patients and healthcare system efficiency. Elena realized that healthcare consciousness integration was facing systemic resistance, not because it compromised medical effectiveness, but because it demonstrated superior healthcare outcomes. This challenged existing assumptions about the relationship between medical treatment and healing relationships, threatening institutional systems that profited from healthcare inefficiency and patient dependency. These systems preferred medical approaches that maintained patient dependence rather than fostering healing empowerment and clinical excellence that serve both therapeutic effectiveness and cost reduction through enhanced healthcare quality. The development phase showed Elena experimenting with different approaches to defending healthcare consciousness integrity while addressing legitimate concerns about patient safety and clinical effectiveness. She needed to preserve the awareness-based relationship qualities that made consciousness approaches genuinely healing rather than just cost-effective alternatives to conventional medical interventions. These alternatives might provide administrative efficiency but couldn't access the therapeutic relationship qualities that made consciousness-enhanced healthcare genuinely effective for patient healing and provider satisfaction. Her first innovation was developing what she called clinical consciousness protocols, systemic documentation of awareness techniques applied to patient care that could satisfy medical evaluation while preserving essential healing relationship qualities. These protocols included awareness-enhanced patient assessment that improved diagnostic accuracy through enhanced clinical attention and intuitive assessment capabilities. Consciousness-supported communication enhanced treatment adherence and patient empowerment through therapeutic relationship that honored both medical expertise and patient autonomy. Mindful presence during medical procedures reduced clinical errors and improved patient comfort through enhanced provider attention and emotional regulation that supported both clinical precision and therapeutic relationship quality. Emotional regulation techniques supported healthcare provider effectiveness during challenging clinical situations that required both technical competence and emotional stability under pressure from medical cases and institutional demands for clinical efficiency. Elena's second innovation involved creating what she privately termed healing outcomes documentation. Methods for measuring consciousness effects in healthcare using both conventional method metrics, or conventional medical metrics, and qualitative assessments. These captured therapeutic relationships and the improvements from them, and as well as patient empowerment qualities that contributed to healing in ways that purely technical medical approaches couldn't access. But these qualities satisfied institutional requirements for clinical validation through measurable healthcare involvements and improvements that demonstrated both therapeutic effectiveness and cost efficiency. Her work with Denver's healthcare consciousness community revealed that awareness practices gained through clinical validation, that these demonstrated superior rather than just alternative medical outcomes. This proved that consciousness-enhanced healing relationships could satisfy institutional requirements while serving patient empowerment and provider wellness. These served healthcare improvement in ways that conventional medical practice often overlooked in favor of efficient treatment delivery that prioritized throughput over therapeutic effectiveness and patient satisfaction. Elena's integration practice involved standing at the hospital rooftop garden at noon, sensing into the healthcare consciousness work that was influencing medical care throughout Denver's healthcare system. She maintained connection with consciousness communities in other cities, developing their own approaches to awareness-enhanced healing. These served both clinical effectiveness and healthcare transformation that could benefit medical practice beyond individual consciousness communities through practical applications that enhance both patient care and provider wellness. The practice revealed that healthcare consciousness operated through healing presence rather than medical technique. It created connections between clinical expertise, therapeutic relationships, and patient empowerment that enhanced everyone's capacity for healing while preserving medical effectiveness. This effectiveness, it satisfied both professional standards and institutional requirements for clinical outcomes and patient safety, and protected both patients and the healthcare providers from medical malpractice while maintaining therapeutic excellence. But the integration practice also revealed tension patterns that indicated how much Elena had been unconsciously carrying institutional responsibility for proving that consciousness approaches could serve medical effectiveness without compromising professional credibility or patient safety. This required her to maintain awareness practices that serve both individual development and institutional validation. Such validation could protect consciousness-enhanced healthcare from regulatory challenges that might prevent healthcare workers from applying awareness techniques, even when they demonstrated measurable improvements in both clinical outcomes and therapeutic relationships. As she breathed into these physical sensations, allowing them to be present without trying to eliminate them through individual spiritual practices that might serve personal development, but could address institutional challenges, something shifted. The memory that surfaced was from back in book 2, during her medical research breakthrough when she had first discovered that consciousness techniques could enhance clinical effectiveness while serving both patient healing and provider development through therapeutic relationships that honored both medical expertise and human development. Healthcare that serves consciousness development, she remembered that the stranger told her after witnessing the transformative clinical discovery. She said it doesn't operate or it doesn't separate medical expertise from healing relationships. It reveals how clinical skills can serve both treatment effectiveness and patient empowerment through medical care that honors both scientific knowledge and healing presence. This integration served both clinical excellence and therapeutic relationship development that enhanced rather than replaced medical expertise with consciousness applications. The insight landed in Elena's awareness like perfectly coordinated medical intervention that demonstrated these principles through practical effectiveness rather than theoretical explanation. Healthcare consciousness wasn't about imposing spiritual practices on medical treatment. It was about revealing the awareness dimensions that existed within all authentic medical care. These dimensions had been overlooked in favor of technical efficiency that prioritized treatment delivery over healing relationships that serve both clinical outcomes and patient empowerment through therapeutic partnerships. Elena's transformation came through recognizing that healthcare consciousness gained its strength not from separating awareness practices from medical treatment, but from enhancing the clinical effectiveness and healing relationship that made all medical care more therapeutic. The most effective healthcare consciousness work happened when awareness practices served medical excellence rather than replacing clinical expertise with spiritual alternatives. Such alternatives might appeal to consciousness communities but couldn't demonstrate superior therapeutic outcomes that satisfied both clinical evaluation and patient healing needs. The transformation continued as Elena understood that healthcare consciousness revealed universal principles of healing that operated through rather than despite medical expertise. This demonstrated that consciousness approaches could serve both clinical effectiveness and patient empowerment while maintaining professional standards. These standards satisfied institutional requirements and regulatory oversight that protected both patients and healthcare providers while ensuring therapeutic excellence through awareness-enhanced medical practice. They spent the remaining integration session developing what Elena came to call healthcare consciousness protocols, systemic approaches for applying awareness practices to medical care while preserving clinical effectiveness and professional standards. These serve both healing relationships and institutional requirements for patient safety and therapeutic outcomes that satisfied regulatory oversight while maintaining the essential awareness-based qualities that made consciousness-enhanced healthcare genuinely therapeutic. The protocols included clinical presence enhancement, using awareness practices to improve diagnostic accuracy and treatment planning through enhanced attention to patient assessment and clinical observation. therapeutic relationship support, applied consciousness techniques to foster healing partnerships that serve both patient empowerment and treatment adherence through collaborative medical care that honored both clinical expertise and patient autonomy. Provider wellness integration. This used awareness practices to maintain healthcare worker effectiveness while reducing professional burnout and emotional exhaustion that affected clinical performance. Medical error prevention. This applied present moment awareness to clinical procedures to enhance patient safety and treatment precision through enhanced provider attention and emotional regulation during medical procedures. Institutional integration demonstrated consciousness effects through clinical outcomes that satisfied medical evaluation while preserving authentic healing relationships that serve both therapeutic effectiveness and patient empowerment through consciousness-enhanced healthcare delivery. As the healthcare conscious integration session concluded with unprecedented success, medical staff reported enhanced clinical effectiveness and improved patient relationships without compromising professional standards or institutional requirements. Elena realized they had discovered principles for consciousness-enhanced healthcare. These could serve as a foundation for medical practice addressing both clinical excellence and healing relationships while maintaining professional credibility and regulatory compliance that protected both patients and healthcare providers. But the institutional challenges also revealed that healthcare consciousness applications were proving more effective under scrutiny than supportive condition. They generated documentation and validation that satisfied regulatory requirements while preserving essential healing relationship qualities. These qualities made consciousness approaches genuinely therapeutic rather than just alternative medical techniques that appealed to the spiritually inclined patients, but these couldn't demonstrate superior clinical outcomes that satisfied both institutional evaluation and patient healing needs. The bridge to continued healthcare consciousness work emerged through Elena's recognition that awareness practices could enhance medical effectiveness while preserving authentic healing relationships and professional standards. But success had also revealed that consciousness-enhanced healthcare attracted institutional resistance from forces that benefited from healthcare systems prioritizing profit over healing effectiveness. This required network-level coordination and strategic support for healthcare workers engaged in consciousness approaches to medical care that serve both clinical excellence and patient empowerment through therapeutic relationships. The question that would drive continued healthcare consciousness development had become clear. Could consciousness communities develop healthcare applications that maintained authentic clinical effectiveness and healing relationships while providing protection and strategic support for healthcare workers facing institutional opposition? Such opposition was designed to prevent awareness-enhanced medical care from demonstrating superior therapeutic outcomes that challenged existing healthcare systems designed around profit maximization rather than healing excellence and patient empowerment through therapeutic partnerships. The invisible work of consciousness development was becoming visible through healthcare applications that demonstrated human capacity for healing, enhanced by awareness practices. This capacity wasn't limited by institutional systems designed to maintain healthcare inefficiency and patient dependency serving corporate interests rather than therapeutic excellence. Patient empowerment through healing relationships honored both medical expertise and consciousness development while maintaining clinical effectiveness and professional standards that both healthcare quality and patient satisfaction.